Hello and welcome to this edition of Doc Talks. I'm Dr. Don Selby, a naturopathic medical doctor practicing at Copper Valley Medical. Today we are going to talk about influenza. Influenza, or the flu as it is commonly called, is a viral infection of the respiratory tract. It is a seasonal disease with a season that starts around Thanksgiving and extends into springtime. This disease is contagious, spread from person to person by what we refer to as droplets, so coughs, sneezes, and even tissues contaminated with the virus. In many people, the illness can be mild. However, in some people, the illness can be very severe and even life-threatening. This flu season has been particularly bad, and so far in the 2017-2018 season, Centers for Disease Control and Prevention is reporting the death of 37 children and at least 25 elderly persons. Symptoms of the flu will vary, but commonly include a sudden onset, fever that is going to last 3 to 4 days, some aches, chills, and fatigue. The differences between the flu and a common cold can be confusing even to some healthcare professionals. However, there are some unique differences. The onset of a cold is gradual while the onset of flu is abrupt. Fever is rare in a cold. A cold usually doesn't produce body aches and does not usually produce the sensation of chills. A cold usually results in a sore throat, stuffy nose, and sneezing, while the flu does not. However, both diseases may cause coughing. Complications of the flu include respiratory illness such as pneumonia, bronchitis, exacerbation of COPD, infections of the ears, infections of the sinuses. In fact, chronic diseases may be made worse by the flu. People with asthma may experience asthma attacks. People with congestive heart failure may find it worse during or after the flu. Persons at high risk for complications must be monitored very carefully. Those include anyone who is immunocompromised, young children, anyone over 65 years of age, anyone with a chronic disease, but especially asthma, COPD, and diabetes, and pregnant women. Warning signs of these complications include the respiratory distress of difficulty breathing, cyanosis, which is a bluish color around the skin of the nose and mouth. In an infant, retraction between the ribs may be seen. This is an emergency situation. Patients may also have lethargy, that is, they look toxic, have a loss of appetite, failure to interact with others, children who cry without tears. Anyone exhibiting these signs and symptoms of complications of flu need to be seen urgently. Most people who get the flu can treat themselves quite effectively with over-the-counter medications, getting plenty of rest, and lots of fluids. However, people who are very sick or are at high risk of serious complications may need an antiviral drug prescribed for them. Remember, since flu is caused by a virus, antibiotics are of no help and may make someone even more sick. The antiviral drugs, though, are extremely limited in their effect and may have side effects. If taken within 48 hours of onset, for a full 5 days, the use of an antiviral drug may reduce the length of illness by 1 or 2 days. The side effects, especially in children, can be quite severe. Reports have shown psychoses and neurologic defects. Children getting an antiviral drug for the flu must be watched very carefully. Most doctors and public health authorities will recommend preventing the flu with a flu shot every year. It is important to get the shot every year. We admit there may be side effects from the vaccine, but those side effects will be far less severe than getting the flu. The flu vaccine is not guaranteed to be effective. It's not guaranteed to make sure you don't have the flu, because the flu virus changes every year and sometimes the vaccine isn't perfect, but it's the best we've got and it's a really good idea. To further reduce your risk of getting the flu, We recommend that you eat healthy all year long and use medical-grade nutritional supplements. Your naturopathic physician can assist you with that if you need it. We also recommend you wash your hands frequently with hot soapy water and avoid coming in contact with people who are ill or who sneeze or cough into their hands or fail to cover their sneezes at all. It is important for everyone to understand that aspirin should never be taken during or for 2 weeks after any viral infection, especially the flu or also chickenpox. The use of aspirin during or following a viral illness such as the flu has been linked to a condition known as Reye's syndrome. This condition may result in permanent brain damage or death. Flu is a very serious disease. Please don't take it lightly. Thanks for joining us for this edition of Doc Talks. Again, I'm Dr. Don Selby, a naturopathic physician at Copper Valley Medical on Alma School Road in Chandler, Arizona. Our website is coppervalleymedical.net. Stay healthy.